Welcome to Imagination and Co-Creation, the Midwest Chapter Medical Librarian Association Conference for 2025. The NNLM Region 6 update, and we'll begin in session.
LM update at this year's conference. Darlene serves as Associate Director for Region 6 of the Network of the National Library of Medicine at the University of Iowa. Since 2016, she has championed equitable access to biomedical information, leading innovative outreach initiatives, building partnerships, and managing more than $1 million in federal subawards. Darlene holds a Master of Library Science from Indiana University Bloomington and previously spent 25 years as a law librarian. Her expertise includes developing award-winning programs in health information literacy, digital equity, and community engagement. Among her accomplishments, Darlene helped create the NNLM Reading Club and Telehealth Interest Group and launched a regional community guide to advance health information equity. She's also instrumental in NNLM's outreach to underrepresented communities, having established the ambassador program for the All of Us initiative. We look forward to Darlene's insights and updates on current NNLM initiatives and opportunities for our region. Welcome, Darlene.
Nancy, thank you very much, and thank you for inviting me to give the NNLM update. So I'm just going to start by saying if there's anybody that's new to MLA or our program, I'd just like to give you a little bit of background about our organization. NLM is the National Library of Medicine, and it's one of the 27 institutes and offices of the National Institutes of Health, NIH. And NLM is one of the largest, or is the largest biomedical library in the world, and it produces online resources such as PubMed and Medline Plus. Then NNLM is the network of the National Library of Medicine. It's the outreach program of NLM. And we're here to help ensure that health professionals and the public have equal access to health information. And NNLM is made up of 7 regional medical libraries, 3 national offices, and 4 national centers, all providing training, funding, and engagement opportunities to over 9,000 member organizations. And this is what we look like. We're comprised of 7 regions, as I mentioned. Our regions do not completely overlap with the MLA chapters. So if you're from Kentucky, please know that you are part of NNLM Region 1, and that's based out of the University of Maryland. And if you're from North Dakota, you're part of Region 4, based out of the University of Utah. And if you're from any one of these 7 states, you're part of Region 6. And as Nancy mentioned, we're based at the Hardin Library for the Health Sciences at the University of Iowa. So thank you for letting me go through that. Now here is your Region 6 staff. And if you've been with us for any amount of time, you will recognize some familiar faces. There's Jacqueline Luskovic and Miles Dietz-Castell and Nora Barnett. We also have joining us this year, John Kolshar. He is our new principal investigator because Linda Walton retired this spring. Missing from our staff, people that you may have interacted with in the past are Bobby Newman and Erica Lake. They have left for new positions. But we are grateful that we've had Stefania Acosta Ramirez with us. She was formerly with the National All of Us Program Center. She's been filling in for us temporarily. So it's kind of bittersweet that I have to introduce her and then say goodbye because she will be ending her time with us at the end of October. Okay, I would be remiss if I didn't acknowledge that these are challenging times for federal government agencies, and that includes the National Library of Medicine and our network. But I am happy to report that all the NNLM regions, offices, and centers have received their federal funding for year 5. And we also want you to know that the NLM databases that you rely on and trust, clinicaltrials.gov, Medline Plus, PubMed, they're available to you. And as has been the practice forever, if you look at the bottom of the page, you'll see a date for when the information was last updated. So for example, if you were to search uterine cancer and midline plus, at the very bottom of the page, you would see that it was updated as of August 13th, 2025. We have some more good news. The National Library of Medicine redesigned its NLM data set catalog in August. They expanded the coverage from like 80,000 records to over 2 million NIH-approved biomedical data sets. And the redesigned interface expands filtering options and provides an updated user guide for easy navigation and search. PubMed also gets little incremental improvements in usability and search. Recently, for example, the display options interface to show or hide abstract snippets has been updated. And they also added an update to journal searching. So for example, a search for New England Journal of Medicine will now appear as the New England Journal of Medicine. So you no longer need to put the into the journal title. Anyway, you can find more information about our databases by simply looking at the user guides that are linked from the home pages. One thing that has happened due to the current government shutdown, NLM is unable to lend at this time, but lending between all of the DocLine participant libraries continues. So if you have any questions about DocLine, just contact your RM, your regional medical library office. And here are those addresses. So let's turn our attention to network news. Network is part of our name for a reason. And I think that's because we really count on your engagement to help support our mission. To date, Region 6 has 1,257 member organizations enrolled. And here's a list of some of our most newest additions. If you're not sure if your organization is a member, you just simply come to our website and look at our NLM membership directory. If your organization is not a member, please consider joining. And let me give you some good reasons for joining and why many of your peers have joined us. Professional development is one of the main reasons. They engage for our training, and in collaboration with the National Training Office and our National Center for Data Services, we offer free certified education classes and webinars so that you can earn your MLA specialization, whether it's consumer health, data services, or systematic reviews. And if you don't know this already, you can actually have our network pay for your MLA application fee to receive your specialization certification. And we've recently made this much easier. We've created one simple form that you have to fill out, and then you submit it. MLA will send you a coupon code that covers the cost of your application. You submit for your application to MLA, your specialization, and then you'll soon receive a formal letter of recognition and a certificate. You can learn more if you scan the QR code. Now, not only do we offer classes for MLA CE, we also offer courses for you or anybody you work with in your organization to earn credit for continuing nursing education, CNE, and CHES. That's the Certified Health Education Specialist. And here's an example of one program that's coming up in which you could earn all three of those credits. Region 6 is going to offer a special 3-part webinar series called Improving Cancer for Rural Communities. This program explores innovative strategies to improve rural cancer care, spotlighting the Iowa Cancer Affiliate Network called ICANN. The first session is coming up on November 4th. They're going to look at the challenges that health professionals face in delivering high-quality cancer care in rural settings. Then they're going to also introduce this ICANN collaborative, scalable model for expanding access to oncology expertise and strengthening evidence-based care. So we hope you'll join us for one or all of these sessions. Simply use this QR code. It'll take you right to the registration page. And you can always come and register at nlm.gov/training, which is what you see right here. Here are a few other classes that are coming up in the next 2 to 3 weeks. And please know that we offer classes in a variety of formats. We have webinars, we have 1-hour online presentations, many asynchronous and on-demand courses. So again, just visit our training website to search and register. But there's more to professional development. Not only do we provide NNLM classes in which you can earn your CE credits, we will, Region 6, while money is still available, we will fund your organization to host an MLA webinar. And this would allow you to secure 25 codes for 25 individuals, I should say. Learn more about our sponsorship program by visiting our website that you have on the screen. So professional development training is just one. It's a very big reason why people like to engage with NNLM, but there's other opportunities. Several of your peers are partnering with us to support the NNLM mission to expand access to biomedical and consumer health information. So for example, the Region 6 Partner Outreach Program, which we like to call POP, it's comprised of 15 organizations in our region who serve as what we want to call our ambassadors. These POP members help identify priority health information needs in their communities, and then together we find ways to meet those needs. It might be that the POP members disseminate our health information resources at local health fairs or association meetings. They might even teach one of our consumer health information courses. So from October of 2021 through May of 2025, our POP members have held 157 events. I highly applaud all of you. That's a big number of events. So thank you to our POP members. And I want to say thank you to Jacqueline. She also organizes this group. Another voluntary program we have several members nationwide who are serving as advisors for the NNLM Reading Club. They're voluntary, and they're helping us identify health topics and select books each month. During the last year, they sourced titles for topics such as chronic pain, loneliness and isolation, complementary and integrated health, and mental health and social media. And I will say that these are topics that they came up with, so we appreciate that. They know what's important to their communities. And if you haven't heard of the NNLM Reading Club, I'm glad you asked what it is. Since 2018, NNLM staff have identified health topics and selected fiction, nonfiction, memoirs, graphic medicine, young adult, all types of genres for book clubs to read and discuss. Each book comes with a discussion guide and a list of health information resources. I was looking back, I added it up, and to date, since 2018, since we started this, the club has selected 195 books, over 50 topics. So it's a rich, robust resource for you. I hope that you'll take a look and use it. And recently, we did have an NLM, a health science librarian, I should have reached out to us and told us that they were very grateful for the chronic pain series. This person reported they felt finally seen after reading one of the books. This health librarian also said that their academic health science library hosts Self-Care's book club program. So she's going to start selecting books from our program and hosting reading clubs and sharing, of course, the health information that comes with it. And she is excited to do this. And she said, I'm going to be sharing this material with medical providers, staff, family, and other personal people in her life. So we really appreciate those that kind of feedback. Now this program, although it's finished for this cooperative agreement, I want to recognize the more than 55 members who served on our 7 state advisory groups, and we called it SAG, and they worked with us for the last 4 years. We took our advisory group to a different level. We wanted to engage them, to activate them, instead of us just talking to them and reporting to them. So we formed interdisciplinary groups. We asked all types of librarians and health professionals and people interested in health information to join us. So we had doctors, we had health science librarians, hospital librarians, public health departments, a variety of people rose to the occasion. And they helped identify a health need, a pressing health need in their area or in their region. And then with their help, we developed health information books, infographics, videos, toolkits, and guides. And some of these disparities that three of the states identified mental health, substance use, and with their help, because they're partnering with us, we were able to reach hard to reach populations that we don't normally have access to, such as the Amish or Plain communities. So I just encourage you to scan this QR code because you will be able to download our recently published State Advisory Group's report. And we've made it very easy to access all the toolkits, via links and the materials and presentations, as well as our charters, logic models, surveys, everything we used in this program. It's available for you to use, replicate, and share. And next week, I think it's next week, we're going to be featuring one of the projects. This is the Illinois SAG project called Smart Tablet Education for Healthy Living. Digital literacy was their project. They saw an increasingly important part of raising awareness for digital literacy training among seniors. And so in this session, they'll examine the strategies they used for expanding digital education initiatives. So please come to nnlm.gov/training and register for this 1-hour webinar. Now we do have a current opportunity. We're hoping that you will participate in next month when we have a couple of sessions for listening. We want to hear from all of you. Erica Lake, since 2022, she's been hosting these annual listening sessions. And this year, Jacqueline Leskovic will be the moderator. So these are the 2 dates we have selected and the times. Very soon we will have the registration link posted. So please follow us on our newsletter or social media sites. So stay tuned and register for that. So if you're not a member, as I mentioned earlier, I encourage you to join. And for anyone who's out there, you can learn about our upcoming classes, webinar products, and programs by simply subscribing to our Friday newsletter and following us on Facebook or LinkedIn. So that's the news from, from Region 6. But I also want to share a couple of updates for Region 1 and Region 4. So if you're in Kentucky, please know that they're going to have a virtual office hour available to you on October 23rd at 1 p.m. Eastern Time. So please put this on your calendar and you can register using the QR code that you see on the screen. And for Region 4, our North Dakota folks, this is your team in Region 4. I hope that you all are familiar or have worked with David Brown. He represents your state. And Region 4 has a focus on rural healthcare and getting quality access information out there to them, as well as providing this professional training to all of you in public libraries and health sciences librarians. Here are some of their programming highlights of recent times. They've been attending conferences such as the Tri-Conference in Grand Forks, North Dakota. They were able to award 2 professional development awards funding so that 2 librarians could attend that conference. And they continue their great work and relationship building with the University of North Dakota School of Medicine and Health Science Library. So that is what I have available for you today. So thank you for taking time to attend, and I'll do my best to answer any questions or take your comments. And let me look at the chat box. Well, thank you for putting in the links. Any questions?
Darlene, this is Nancy. I'll ask you a question. You mentioned that funding was continued for the NNLMs in the for year 5. Is it too soon to know about what will whether there will be future contracts or the likelihood of funding beyond that 5th year?
It is too soon, yes, especially right now with the government shutdown. Please know that NLM takes their mission seriously, and they really care about the work and their mission. But yes, too soon, unfortunately.
Let's see, there are some other questions in the chat.
Miss them?
Can you still order material? And is there a PubMed brochure?
Yes, I think we do have a PubMed brochure. Please reach out to the Region 6 email address. Miles Dietz Castell sends out materials. So yes, we are still sending out material for you to pass along to share. And you also can download them, I think. You'd have to print them yourselves, but they are available from our website, the nnlm.gov website.
We still have some time if there are other questions. Feel free to either enter them into chat or to unmute and ask Diane the questions directly.
Not a question, just a comment, repeating one of the chats. Thank you for everything you do.
Oh, thank you very much. We like the work we do. We feel it's very important. And as you know, from the beginning, when she introduced me, I came from law as my background. And I've just been so impressed with the professionalism of this industry, or all of you, my peers in a different subject matter area. And I've really enjoyed getting to know consumer health quite well and working with communities across the United States. It's become almost a calling. So we all do important work.
I'll ask another question, Diane, about the certificate programs that you mentioned. So the specializations that you can do in consumer health and systematic reviews and data. Just off the top of your head, do you have a general sense of the amount of time to complete those, or the number of courses or sessions to complete those certificates?
Well, our courses, we offer usually 1 credit per hour. So if a course were, if it were an on-demand course and it was 4 hours, you'd be earning 4 hours of credit. For CHIS, I think there's 2 levels of certification. There's CHIS 1, CHIS 2. I think CHIS 1 is 12 hours, CHIS 2 is 12. You all may know better than I do since you are MLA professionals. But I would say it's 1 hour per credit.
Okay. Those are great for professional development. Okay. So I'll do one last call for any other questions.